So a major trend, I think, at ASCO and in the oncology landscape today is Vice President Biden's Moonshot initiative. So can you share with us a little bit how you see this initiative, how it's going to influence research and cancer care?
Yeah, well, I was actually on the phone with the Vice President last week, and we were really talking about the advances in the field, and one of the points that he made was that this is a very exciting time. And we've also raised expectations quite a bit, and so I think we do have to deliver now. But I think it is a time of hope for patients. There are new treatments. We're particularly excited about the idea now of combining some of these therapies together and getting better responses. And so I think it's important that patients who may be suffering with one of these cancers is able to get into a clinical trial or get access to what I think is going to be an increasing standard across the board. I think the big advance with immuno-oncology today is that this is not something that happens rarely. This may happen in many, if not all, types of cancer. And I recently wrote an editorial where I coined the term precision immunology. So just like in precision medicine, where you can look at the genetic mutations within a cancer cell and then develop a targeted therapy approach, I think we're at the threshold of looking at what the immune system is doing in an individual patient's cancer, and then we can get the right immunotherapy drug or combination of drugs to that patient.
And do you think that with the advent of immunotherapy, are we sort of coming around to better treatments that maybe don't have quite so severe side effects for patients?
Yeah. You know, every medication has a side effect, and so I think it's important to be aware of that. But these are, in general, very manageable. Now that we've had these drugs with us for a while, we've developed good methods for treating them. When we did our trial, we got patients that were traveling from, other cities to come to our center. And one day, one of my patients who was actually coming from Chicago to New Jersey, had her treatment, and then I went out to dinner with her and her husband, and we were remarking that, in the days of chemotherapy, patients were often quite debilitated. They would have a lot of nausea, their hair would fall out. The last thing they would want to do is go out to dinner. And a few hours after treatment, to be able to go out and have dinner as if nothing was wrong, I could see firsthand the impact this was having on patients' quality of life.
Well, that's wonderful. Dr. Kaufman, thank you so much for sitting with me today. I hope you enjoy the rest of ASCO.
Thank you.